Well, House Republicans are announcing their plan to overhaul health care in response to House Speaker Nancy Pelosi's measure. And here's what's in the GOP bill. It offers billions in incentives for states that get more people insured. It limits damages in medical malpractice lawsuits, does not require people to buy insurance or require employers to offer it, and does not explicitly prohibit insurers from denying coverage to those with pre-existing conditions. Joining me now is Republican Congressman Bill Cassidy, who is also a doctor in Louisiana. Representative, thank you so much for being with us today.
Thank you for having me.
I'd love to run through those four things because, frankly, you have me stumped on 3 out of 4. Okay. Offering billions of incentives to states to get more people insured. I want to know how you're going to do that. Tort reform, I get. Not requiring people to get health care insurance, that doesn't make any sense to me if we're going to increase the insurance pool. And the pre-existing conditions, the fact that the insurance companies can get around that by dinging people with up to a 50% surcharge, there's nothing ethical about that at all.
A couple things, Nancy. We know that if you lower cost, you increase access. If you look at the Kaiser Family Foundation study about health savings accounts, they found that a family of 4 with a health savings account and a wraparound catastrophic policy had insurance costs 30% less than a family with a traditional insurance policy, and access preventive services just as frequently. And 27% of folks who had these policies were previously uninsured. Now you can say if you lower cost, you've increased access to quality care. Now, we may decide, as the Democrats do, that Washington is the best place to figure out the particulars of a local market, where the local market will somehow expand coverage. Or we may say, no, local government is better than government from D.C. So I frankly support the emphasis upon the states doing this. States are closer to the problems.
Right,
Wyoming is different than New York City.
If we take this into your backyard, you're a GI doc in Louisiana, and someone comes in with a pre-existing condition, which means they either don't have the insurance to pay you, or you're going to have to do it gratis. I know, because of the way doctors bill, you're already pinched. This screws you.
Well, a couple things. The emphasis upon high-risk pools allows those folks who are not able to gain insurance through their group market to go into the high-risk pool. Think about a small group, say 4 people. If one person needs a liver transplant, that can blow the rates out for the other 3 people. On the other hand, if that one person is able to enter into the high-risk pool, that, if you will, rescues the insurance product for the other 3. It, if you will, socializes the cost of the care of the high-cost patient.
But, you know, at the end of the day, if we can mandate auto insurance, and we know that that changes the pool, I don't understand why we don't mandate medical insurance. And on the very surface of this, it looks like a big wet kiss to the health insurance companies.
Well, a couple things. As we know, there is a tension between the 2 parties. The Democrats clearly are not as interested in personal freedom as the Republicans. So the Democrats do not have a problem with individual mandates. The Republicans have been the party of liberty, and so they are very hesitant to have an individual mandate. On the other hand, our emphasis upon association health plans have always been opposed by insurance companies. So it's a little bit hard to say it's a wet kiss when insurance companies have always opposed the provisions that we are advancing.
But, Congressman, I think one of the things that people really haven't talked about is that if you look at the average physician in practice and you say to that doc, hey, listen, you've got to cut your costs, your reimbursement's going to be less, but, oh, by the way, see more patients in 15 minutes. There is a radical difference in thinking, because I can't make you more efficient. I can't make you better. And frankly, I can't make you technologically better than you are. So we know the economic model is broken. But I don't understand as a physician why you don't want to turn things more upside down. These are Band-Aids on a system that isn't working anyway.
I would love to turn it upside down, and that's what concerns me about the Democratic proposal. You know, the way they balance it, the way that supposedly it doesn't add to the deficit, they cut physician reimbursement on Medicare patients 21% in 2010, and they presume that that cut continues going forward.
But you also know that there are private insurance companies that are paying 80% of Medicare, and in some states, there's no competition, period.
As it turns out, if you look at kind of the McKinsey and Company type third-party objective analysis. They say as a rule, private insurance companies pay 133% of cost to make up for the fact that the government programs, Medicare and Medicaid, pay below cost. And so there may be a couple of insurance companies doing that. But if you look at the objective data, Dr. Nancy, private insurance is private premiums are paying 130% of cost.
Congressman Cassidy, you and I may not look at this the same way, but as a physician, I know we're in the same arena. We got to figure out a way to make this work. I appreciate you taking the time today.
Thank you very much.
Thank you. Well, now we're going to look